say and spell your name for me and then tell me what you do for IU Health?
Sure. First name's Paul. Last name is Calkins. Calkins. I'm the interim chief medical executive for IU Health.
Okay. So today we're talking about the large increase in COVID cases that we're seeing here locally. Can you just paint the picture of what it's looking like for IU Health facilities?
Well, we have 278 patients in all of our facilities that are known to be COVID positive today. In April, that was 258. So we've exceeded that. It's a little bit differently distributed. Most of the patients were in the metro area. Now they're literally everywhere. Every one of our 16 hospitals has at least one and usually several COVID patients in it. It's a very broad-based problem.
And you say all the hospitals have cases. Are any hospitals inundated to a place where they can't handle anymore?
We have been lucky that we have not reached that point yet. The first hospital that was really seriously affected was our IU Health Ball Hospital in Muncie. Luckily, we were able to shift resources and people over to them to help them keep going, and they have managed to stay ahead of it, even though they have a very large number of patients over there toward the east. We have a critical access hospital down in Bedford who is licensed for 25 beds, and today they have 18 COVID patients. So a very large COVID burden, but they have managed to control that and take care of those patients in the great way that they always do. And one of the ways they do that is our ability to move resources from place to place.
In the spring, we talked about a shortage or the need for ventilators. Are we seeing that now, or have we learned different things about this illness where that is not as necessary these days?
So we still do put patients on the ventilator, but in the spring, we were putting about 30% of our COVID inpatients on the ventilator at any given time. That number is more like 10 to 12% now. We use different oxygen delivery systems, and it turns out that a lot of the patients that we put on ventilators in the spring don't really need to be on ventilation, and in fact probably benefit from not being ventilated. We've learned a lot about this disease in the last 6-8 months.
Though we've learned a lot about this disease in the last few months, the numbers we are seeing, is there still need to be alarmed, or is this something that we are just having to deal with as it runs its course?
Well, I'm alarmed. I think everyone should be alarmed. This is a scary, sneaky disease that can spread silently through populations until it hits someone who gets exceedingly, exceedingly sick. And really, the only way to prevent that person from winding up in one of our hospitals is to be vigilant about possible transmission, because you just don't know who's going to be at the end of the chain that you become part of. This is a very, very, very scary disease, and every hospital in the state is starting to have real issues with these patients. We've spoken to many other hospitals, many other hospital systems, and this disease is just really, I'm going to go ahead and say it, this disease is out of control right now, and we need to get it under control.
Ways to do that?
Wear a mask, wash your hands, socially distance. If you think you might be sick, stay home. Don't assume that it's okay. I know that parents with kids are having terrible problems with this, but you can't send your kid to school if they're sick, or if you think they're sick. Really need to be thinking about Thanksgiving. Big groups. Unfortunately, I like Thanksgiving too. Not a good idea. Keep it small, keep it safe, keep it distanced to the degree that you can. Don't hug. Don't hug people who are outside your bubble. That's just pretty much the face of it here. The thing I would like to say is, we've got therapeutics that are just coming. We've got a vaccine coming. We're getting really close. There's months left. It's not like it's going to end in January, but we're starting to see some progress, and this is the time to double down, not the time to relax.
In the spring, we saw a lot of healthcare workers who were also succumbing to this and ending up patients themselves. Are we seeing that kind of strain now? I'm not hearing too much about healthcare workers who are getting sick as much as I did in the spring.
Well, we actually do have a lot of team members who are on quarantine or isolating, either because they were exposed or because they're sick. We don't really have any evidence that occurred at work in general. We think it's just the fact that they're Hoosiers too. And so the numbers among our team members are similar to the way Indiana is going as a whole. I think we have a lot of team members out right now. I'm trying to dial up the number and I can't get it. I'm sorry. It's
Okay.
hundreds.
But that is still a strain. That has not been something that's gone away now that we know more about it.
We have more. We have several hundred nurses, for example, a couple hundred nurses who are out right now, and we need those folks because we have all these patients. So clearly, yes, it's a definite strain.
Well, I'd like to talk a little bit about the vaccine. How will IU Health store that vaccine when it comes, and then how will the health system distribute it to other facilities when it's time to actually give out the vaccine?
So as you know, we're expecting the first vaccine to be the vaccine from Pfizer. So it needs -70 Celsius storage. The state has developed a very nice comprehensive plan for vaccine placement and distribution, and a lot of it will be coming directly to around 50 hospitals. But there are 5 sort of pre-placement large hospitals scattered around the state, and our IU Health Methodist Hospital is one of those. So at some point, we don't really know when, we'll get a shipment that we need to keep in ultra cold storage. All of the pre-placement hospitals and many of the distribution hospitals have ultra cold storage available. So it's really a very nice comprehensive plan that the state actually went over with us yesterday. We're having regular communications across the state between hospitals, healthcare organizations, and the state. And I think when the vaccine is received its emergency use authorization, we'll be ready to give it.
Will it be under guard?
It will be secured.
Okay.
You won't be seeing machine guns, et cetera, but we're not planning on leaving it sitting out on open tables.
Gotcha. These large numbers that we're seeing, 6,600 roughly today, these numbers that we're seeing seem to be coming over a period of weeks. Does the span of the reporting affect the higher numbers that we're getting, or are we really seeing these numbers fairly accurate depicting the alarm here?
Oh no, we figure they're pretty accurate because yes, it is true that they are sort of gathered over the course of a reporting time frame, but it's sort of the same reporting time frame every time they report a number. So it's not like half of these things happened last month. These numbers are going up. They're going up dramatically. What was it, 6,600 today? That was a shocker.
Right. Do you think people are getting COVID fatigue? They're just tired of it? And is that a challenge for getting people to remain vigilant in fighting it?
Our experience has been asking people about how they got exposed. Well, of course, the first answer is usually, I don't know. But there's no doubt that there's COVID fatigue out there. I have COVID fatigue. I'm sure we all have COVID fatigue. The question is whether your COVID fatigue is going to cause you to take a risk that you later will regret, like lack of social distancing or doing something that you know is probably inadvisable, but you just have to because you wanted to do it for so long. I would love to go to the movies. I will not be going to the movies. That's pretty much the way we feel about it. There is no doubt COVID fatigue is real, and it's a contributor to this.
Okay. Anything you'd like to add?
No, except to stay safe and really think about the coming holidays, because I know that the temptation is going to be difficult, and we need to figure out a way to try to stay strong. And remember that the best way to protect our vulnerable relatives is to really to stay away from them, or at least protect them the best you can.
Okay. Just in time, huh?
Yep. Have a good day. Thanks.
Dr. Colco, thank you. I appreciate it.